Welcome to the Wellness on Tap podcast with your host, Dr. Debs Eastwood.
But on the Thursday, I'm going to have a whole load of holistic diagnostics run. This was a planned thing anyway. It just happens to have fallen at a time that it could be acutely relevant for me.
Yeah.
So,
yeah, there is a technique actually which is really good at resetting C1, C2. So I might show you that afterwards.
Yeah, that'd be really good. That'd be really good because when I got down to London after the fall, the next day I was at the Guna conference, Cyto Solutions, and that was amazing because it reinvigorated my love for cell biology that I'd forgotten because it was like 30 years ago that I was studying it. And this Italian professor whose company it is talking all about physiological dosing of stuff. And it was just mind-blowing. It was wonderful. And he was talking about it in relation to allergy and immunology.
Interesting.
It was really good.
So that was the last episode, was it?
No.
Oh,
this was something a conference I went down to. He would be great to have on, but I'd have to catch him when he was in the UK next.
So I had an interesting sort of immune reaction recently, and it was there's a lady in the village next door to us who sort of has her own business doing sourdough breads, and so I've started buying her breads and had been eating only that bread for I don't know 3-4 months, and then just happened to have a sandwich with sliced bread and ended up covered in hives. And
wow.
So I kind of persevered with it and experimented over a couple of days to see if it was wheat or gluten or preservatives, and I think it was preservative based.
Yeah, probably.
Yeah.
Yeah, and so your body had been away for it a while
and decided you shouldn't have that.
The body's got an amazing way of telling us these things, hasn't it? And we just need to learn to listen, don't we? Because we're so dumbed down from that in today's society because we're literally fed all of this crap, aren't we?
Yeah, but I also think it's we have this image of who we are and what we are and how we operate. And I've never had allergies, and it was like, oh, what's this?
Yeah, what's going on?
And I've never had a problem with any food, no intolerances ever, and suddenly it was a problem. And so I started thinking about it. You kind of go back and think about it more logically, and you think, oh, well, actually, it makes sense. My body's had this great food, and then suddenly I've thrown something else at it, and it's like, I'm not so much liking that anymore.
Yeah. Yeah, I'm going to let you know.
Yeah.
Marvellous. Marvellous. So I'm really looking forward to learning more about you and, what your story is. And little snippets like that of how you've changed things in your life are really relevant and really interesting and add to the rich mix, don't they, that everybody's got. So for those of you that don't know, I'm sitting opposite Nicole Brule-Walker. Have I pronounced that correctly?
You have, absolutely.
Excellent. Good. And she's travelled down here today to talk to me all about what she does as a holistic practitioner, how she lives her life in that way. And I'm going to try and prize out of her a few juicy details of the whys and the wherefores and, how we got here. So where would be the best place to start? I mean, not necessarily the beginning all the time, but I'm going to ask you, you've got a glorious accent that clearly isn't totally a British one. Let's talk about you. Where did you grow up?
So I grew up in Toronto, in Canada. Lived there for, quite a long time until I moved here, really. 2001, I moved over. So I'm nearly sort of evening out the time I've been over there and over here. Still sort of feel quite influenced by it. And I think, a lot more now, really feeling very culturally proud of Canada and the country I came from and supporting people from there.
Of course. Why not indeed? So you've travelled down from up north today.
Yeah.
I guess still the winters there are nothing like you're used to experiencing in Canada?
No, not at all. You do get really tired. Everyone says, oh, I can't believe you moved over here from Canada. Why didn't you make your husband move to the UK, or from the UK to Canada instead? And I just was fed up with winters. 6 months of the year, you're digging your car out to go to work. You're digging it out at the other end of the day to go home. And it was just,
got boring.
Time for a change.
Yeah. Yes, because you are now fully aware that in the UK, the slightest flurry of snow and everything stops.
Yeah, it's great when you hear that on the news and it's sort of like an inch or two and you think, well, try having 6 feet of the stuff.
Yeah. Yeah, we see all these images, and from the States. And I even remember as a kid having snow that I would properly call snow.
And there was, I think, certainly when I first moved over here, we had a couple of winters that I would say were hard for here. And certainly everything's kind of tailing back in that direction. So
yeah. So when you were in Canada, are your family still there?
Yeah, all my family are still there.
Okay, plenty of reasons to go back then, eh?
Yeah, absolutely.
Lovely. And were you interested then in, alternative medicine or healing, or how did that all start?
Yeah, it's an interesting one. I grew up around indigenous communities in Canada, and so we were very near the Rama Reserve. I'd spent a lot of time fascinated by Indian medicine and medicine men and the folklore around it and the connections to nature and the idea that medicine should be a community. And rather than putting somebody in a situation where there's a label on it, it's funny how I've kind of come back around to that myself because I really hate labels of any sort now. But rather than labeling somebody as being ill or wounded or sick, it was just about the positive side of it, about bringing that person back to life through the community.
That's a really different stance, isn't it? And I like that an awful lot more. So I'm just fascinated by the fact you were surrounded by all these wonderful communities. So how would you interact with them? Was it a regular thing? Was it ad hoc? How did that all fit together?
I worked with people from the community, so I was aware from their standpoint what happened within their families, within their groups of friends. I attended a lot of powwows and various ceremonies and things, and just really took to it. It was just something that felt really right, really natural to me, but it wasn't at that stage that I decided I wanted to get into a therapeutic side of things or healing side of things. I'd actually decided to study graphic arts, and I did a year, and I pushed myself to finish the year, and I knew halfway through it just would not work for me as a career. Okay. It was something that I just felt it was really critical. And I think that part of me at that time didn't accept criticism very well. And so I felt like it was one of those things that I would get into and it would destroy me if I stayed there. And so I had to get out and had to do something else. And the something else, actually, I didn't know what I wanted to do because I'd worked as a student, your typical jobs in restaurants and shops and whatever you did to kind of pay your way as you went along. And decided to join the army in Canada. So I joined the army for 5 years. I never thought I'd stay as long as I did. I never thought I'd do as well as I did. And it was kind of through that I became really fascinated in watching people train and how one person might have an injury and then someone else would have the same injury in the same space, yet one person would heal very quickly and the next one would be out for a long time. And it just made me really fascinated about the human body and recovery and how we can make it better somehow, or even just to understand it better, I think, was the original curiosity.
Yeah, I can understand that. And I think I would have felt the same way, especially if you then realised that being in the army wasn't going to be your entire life. I know that I, as a person, would have been looking for other things within it to make my mind sort of more interested.
So it kind of led me down to being in sports. So I worked professionally in sports for some time. And I loved it was that community, that element of being in a community where everybody was pulling and doing their thing and it somehow worked. And, I was lucky enough in lacrosse to work with a team that had won 2 Canadian championships. And it was one of those moments that, you remember every second of it as though it were yesterday, even though it was a long time ago, 1994. And you just, it just solidified that idea that, we need that community around us. And I think it kind of awakened again post-COVID, when we realized that so many people were shut away for so long, that, it was important to have that sense of community and belonging and connection with people. And so my work kind of really evolved again after COVID, but it started in very traditional roots, working as a pitchside therapist, watching injuries unfold, seeing it happen. And then the thing that gave me the most curiosity were the people that walked into my clinic and said, I have this ache and I don't know where it came from.
What I really loved about all of that you've just said is the fact that there's always a link, isn't there, back to something that's happened in earlier life. So your experience with the indigenous communities was making you think about how important the community was in the healing of all these other people from different walks of life that you met later on. I mean, as somebody who's never experienced anything like that, my curiosity is like, I want to know more. I want to know everything about it, but I guess it's just what we would all experience, the joy and the comfort and the fulfillment of being in a community is just so relevant, like you were saying, to our everyday lives now.
Yeah, and I think, it's just come to the forefront so much more. And, people really need to feel that connection and contact with family, with friends, with a wider community to feel important, to feel like they're needed and they share a common goal with people in any way, and sometimes it could be as easy as just attending a class that you enjoy and having that time with people that love what you love, and it's so important.
Yeah, it's a basic human need, isn't it, that not all of us seem to identify with until, like, for instance, you mentioned in COVID, it's taken away.
Yeah, it was kind of a big pivot point in a lot of ways for me. I mean, my work kind of went from being very physically oriented in terms of physical therapies, but I studied human movement and breath work and energy and looked at all the different ways we influence the body in a more positive environment. And when COVID hit, I literally cried for 2 days because I just thought, I can't at the moment wrap my head around how I work with people when I'm not in the room with them, because I was so used to doing that. And then I started thinking, okay, what can't I do and what can I still do? And the movement side of things was really interesting because I studied something called anatomy and motion. And anatomy and motion looks at, based on the gait cycle, there's a pattern of movement that the body inhabits. And when something happens at ground level, this happens higher, this happens higher. And you can kind of map out the whole system. And so I was able to do that online and actually found that being framed by a screen, my skills for looking at patterns and how quickly they stood out were so much more than being in the room with somebody.
Oh, how interesting.
Yeah. It's gone the other way again. I'm gone back to doing more face-to-face. But I found I saw the shapes. It was like I wasn't looking at the anatomy anymore. I was looking at the shape of what somebody should be doing in their body. And so many people carry things, patterns, habits that are from older injuries. And so much of what happens in traditional medicine is that it gets discounted because it was so old and so long ago that it can't possibly be relevant. And then, but it is, and so many of the people I see carrying patterns that are 35, 40, 50 years old, and their body's no longer able to cope with that pattern, and it needs some release, it needs some movement back in places where it doesn't hold it anymore. And so
that is so interesting, and it makes so much sense. I mean, for instance, in a very basic way, if I'd fallen as a teenager, for instance, and knocked something out in my spine, that is potentially going to have a lifelong effect if it's not corrected.
And these are the things that I think, and that kind of harked back to my people that I loved seeing who didn't have a cause for it, and they couldn't find anything on x-rays, they couldn't find anything on scans, and yet this person was clearly in pain, and you think, well, there has to be a reason. So I kind of set out to find what that reason was, and it kind of expanded from there into more of the nervous system and looking at stress and anxiety, and it was partly because those were things that I experienced. and I found my way out of them, and I wanted to share that with other people. And then I started realizing that some of the reasons why we don't move in a certain way is because of anxiety and because our nervous system's needing support, and we're afraid to do that. And so much of how we hold ourselves back from our own potential is in our minds and in our bodies is through fear or pain. And I wanted to find the most meaningful tools to help people with that.
I think that's fascinating, because when people think about mindset as such and limiting beliefs, they often will think about it purely in a sense of, for instance, why can't I make my business move forward? But you're looking at it from an individualized person perspective.
And that's what it harks back to almost every time. I mean, so much of what we look at in terms of success and who we are as a person is so externally validated. And really the work we have to do is on ourselves to really make big growth and really change who we are. And, you know, in order to do that, you have to get rid of those layers of stiffness and aches and pain and the mindset issues and the limiting beliefs. And it's all one big package, but it happens a lot quicker than most people think it can. And it's all about sort of working cohesively with all the different systems in the body to make sure that the environment's right, because so many people go through mental health crisis and they look at it from a top-down method and they'll go for talking therapies. My method's more bottom-up and it's more somatic, and it's about how do we release that from the cells in your body so that you feel you can be free of it and move forward in a different way without those shackles. And I talk about veils a lot because I think a lot of us live with veils of things that stop us from being who we could be.
Do you think maybe we don't always know that those veils are present or what they are?
Definitely. I mean, I think from a nervous system point of view, there's not nearly enough focus on what having anxiety does to you. Most people don't recognize they hold any sort of anxiety. And so as part of that, you create behaviors to make yourself safe. And those behaviors limit you. They make you a different person. And so I'm always saying to people, your anxiety is not who you are. It is separate to you. It's a reaction. And let's try and dig back through all of that to find out who you really are. Because, I think I went through it personally myself. I sort of got to a stage where I was so many things to so many different people. I'd forgotten who I was.
Oh, yes.
And people say, what's your favorite food, or where would you like to travel to next? And I'd sit there and just feel stupid because I couldn't think of anything to say.
Yeah.
Because I really didn't know. I didn't know myself anymore. And so I'd say probably my last 5 years has really been about let's find out who I am again and kind of revisit the younger version of myself, because I think I was a much braver person then than I was in the last 10 years.
And it's a wonderful journey, isn't it? This getting to know yourself again. Scary, yes. And quite emotional.
Yeah, I think so. But, there's such a big part of it that's so freeing, because you just think, God, finally I feel like more like myself again. And all these things that I held myself back from and told myself I couldn't do, I can now do. And there's no reason why I should not go for that or not do that.
That's just marvellous, isn't it?
Yeah.
I mean, I feel like I've been on a journey, for the past 6 or 7 years now of finding out exactly that. I can identify completely with what you said about, people would ask you and like, well, I don't know, actually.
And it's quite, you think it's quite scary to get to that stage, and you don't really ever know when it happened. It just gradually pieces of you feel like they've fallen away, and there's just a fragment of you left, and you think, I'm going to protect that with everything I've got now because that's me, and I'm going to find out what that is.
So from your journey, born and brought up in Canada, mixing work-wise with local indigenous communities, which I'm still fascinated by, and meeting your husband, going in the army, interested in art, but it's not floating your boat, made yourself go through it, and then you moved over here. I think there's more to that story that you've not told us about yet. Are there any bits significant in your mind that are missing?
I think really for me, the focus on stress and anxiety came around. I was your classic, I didn't know I had anxiety at all. And then it wasn't until it started impacting me on a negative way, because I do think that people thrive on anxiety in a way that makes them feel more functional, more productive, more busy. And that was me. You know, I was just so busy all the time. And if I just couldn't stop for anything. And if I stopped, I felt guilty. I was resting and I was doing nothing and I was lazy, and, you know, and it was just horrendous. And it then turned into, I think, the anxiety. I'd had a catalyst of, we lived in one place for 16 years. And we were meant to stay there forever. So we thought. We'd kind of established a home. My business was being run from there. We had a separate family business, and 16 years later, the whole hierarchy of the family who owned the properties changed, and it just got taken away from us. And so we had a huge move. My daughter had just come back from doing A-levels down south, wanting to come home and find her feet again. And then we found out we had to give up the place we'd known for 16 years. And so it was about sort of 3 months after that, and I think my body had just decompressed and I started to be sick. And I had 3 episodes of being really sick. I ended up, going to the doctor, looking at blood works and trying to see what was going on in my body. And unfortunately came back with cancer markers of 185 when they should be about 35, 36.
Oh, goodness.
But it was the strangest thing, because I sort of feel like I floated through it. Yes, it was stressful, but I just knew it wasn't. If that makes sense. I just knew in my own body and in my own mind that wasn't what was going to come out of it, but something else had to. So I went through the 2-week pathway, which turned into about a 6-week pathway, I think, because they were just insistent that there had to be something there. And I think it was all stress. So
there was no cancer there?
No, nothing. They found nothing.
Well, thank goodness for that.
I know.
But the stress must have been unbelievable.
It felt like less stress than what we'd already been through with leaving a home and being uprooted in the way that we were uprooted. So I think it just felt like I had to go down this road, and there was something of value there. And for me, it was actually because I'd been pretty fit and well throughout my life and always focused on wellness and health, because that's what I do. I sort of went through a bit of a crisis at that point, because I thought, how can I help people if I'm sick? How are they going to trust me to help them if I'm sick? It was almost like it felt like I'd done this to myself. So I had to kind of find my way back out. And so I had a greater appreciation of what people go through, and so greater compassion and empathy for anybody going down that pathway or any other pathway equally serious. So I feel from a therapeutic context, it really helped me, but it also made me appreciate that there are a lot of people with stress who don't even know it, like me, who just pushed on and kept going and kept thinking, this is just how things are. This is what life is. And it isn't, and it doesn't have to be.
Amazing. So it's almost as though all of that very obvious distress that came after your 16 years should have been a lifetime. Your body seems to have almost said, I'm going to give you something here. It's not real, but you're not going to know that for quite a while. But it's going to make you
sit up and take notice.
Sit up and take notice and almost look at things differently. And amazing.
Yeah, and I think, at that stage, I started to sort of realize that I'd been losing myself gradually over time, and I needed to regain that. And so you gain this bigger appreciation for life, because it isn't infinite. We're not here forever. And, we've got to do what we want to do in that time, and we've got to make the most of it. And it just made me more passionate about digging back to who I really was.
Wonderful.
And am.
Yeah, absolutely.
Yeah.
Yes. So you were starting out in terms of the therapeutic career a long time ago with sports injuries.
Yeah, so it's been over 25 years, but it's been kind of a hell of a journey, really. It's sort of gone from being quite traditional to taking different components in that were more holistic and combining them into my own method, which is called the integrated healing protocol. And so I mainly look at body and mind connections and looking at how we can heal things that are stuck in an environment that is not allowing them to move forward. Because I think even from an injury perspective, so many people discount everything else that happens around you that makes you well. And it's all about sort of healing that ligament, and it takes 6 weeks or 12 weeks or however long to heal it, and then I'm fine. Well, you're not, because some of the things that led you to that point were telling you already weren't. Your body was already not in an optimal position, so the injury happened because it was waiting to happen.
Which I think is fascinating and something that the NHS really doesn't have time to address.
No, and it's definitely time constraint. You know, there's some fantastic people, and, you know, I've had my own dealings with the NHS over time, and there are some amazing people, but it's just, there's not enough time, and there's just not enough time to communicate the things that need communicating to really have that preventative style of treatment and care.
So I'm very much of the opinion that there should be a natural health service that runs alongside the NHS, and this would be something that I would say would be at the forefront.
Yeah, I've always said that. You know, it was interesting when I first moved over here, because in Canada, normally when you set up your practice, you would then go to the local GP surgeries and you would say, you know, I'm here, these are my cards, can I leave them in your reception? And naturally, everybody would be your client if they were coming through. Over here, they weren't willing to do that when I first moved over. Some are more so now, and I do find, because people have had personal dealings with me, they understand the work that I do, so they do recommend me quietly. But it's not really the done thing. They can't be seen to be supporting one person over another, and there's not enough known sometimes about qualifications. You know, sort of, I trained in massage therapy in Canada, and the course there is a 3,000-hour course. Over here, you might train and do a 400-hour course.
Yes.
And then there's a huge discrepancy there. It's much more medical. It's more recognized by insurances over there. There's more research documentation about the benefits of it. So it's hard coming here and sort of feeling like, okay, I'm overqualified, but nobody really recognizes what I do, because it's just a different level of training.
Yeah, and I appreciate that. I mean, I personally got myself trained up in some clinical hypnosis to help my anaesthetic patients, but I am fully aware that the amount of training that I did would be more like your example there, you know, a very short amount of training. But I was just looking at very specific instances and helping a very niche subset of people.
I think it's important to have those level of courses anyway, because it's a door opening for some people, and sometimes it's a door opening to a new passion and a new way of working, and sometimes you need that introduction, and not everybody can dive into a really heavy duty training.
That is entirely true. That is entirely true. I mean, had I wished to pursue it further, the regulatory body in the UK that ran this particular course does offer a full year-long, you know, university-led qualification. But that wasn't for me. But so...
And exactly, you know, and I find that now a lot of the training and the courses I do tend to be online, because it has to fit around whatever else I'm doing. And so that suits me really well. But, you know, I'm a lifelong student. I'm always learning.
Yeah, there's something fascinating about being that, isn't there? I'm a definite sponge as well. You know, I just love learning about new things. It's part of the reason for doing this podcast, is that I've found as I've gone along, is that I just love talking to people and finding out what they do and why they do it and who it helps. And so that kind of segues me nicely into asking you, so what sort of clients would come to you now, and how do they get to you?
Oh, I would say 99, probably 100% really come from word of mouth. People who've worked with me know that I work very differently to, you know, who they would traditionally go and see, you know, so my approach is totally different. The way I work is totally different. Even the way I handle my clients, you know, for me, I never liked the idea that you book an appointment with somebody and you don't see them or speak to them again until your next appointment. So it's very conversational with me. There's always a lot of two-way dialogue, where if I set somebody up with a program, and usually it's more movement-related sequences to bring that back into the body, or it could be something to help with anxiety, it could be something to help them sleep. There's lots of different elements of what I work with, but I tend to, when I do an assessment, look at what are the 3 things that really stand out to me about this person? Because chances are those 3 things could be the catalyst for everything else. And so I find a lot of the times now you could have 10 or 12 different concerns and you're trying to attack them in 10 or 12 different ways. But some of those ways, although they're all good, may be counteracting one another.
With you. Yeah.
And so I think simplifying is really, really important. It also makes it more doable for a lot of people. And there's more longevity in that, I think. There's more success, more longevity in being really simple. And so when somebody has the program, I'm always checking in with them 2 to 3 days, maybe a week later, to say, how's the program going? How are you finding it? What are you feeling? What are you noticing with it? What's changing? Is there anything that doesn't work for you? Let's take that out, put something else in. So it's a very flexible and adaptable program. And it's not a case of giving somebody reams of paper saying, this is your program you're going to do for the rest of your life, because it's a different feeling.
Yeah. And I guess as things improve, there may well be other things, if they had the 10 or 12, you may well think, well, we've sort of addressed a couple of them and they're considerably improved. Please correct me if I'm wrong here. Bring something else in to help the whole the holistic package.
Yeah, and for me, it's always a case of looking at something and saying, what's standing out? What's still there? What do we need to address? How are we going to go about that? And sometimes it's a case that I send them to somebody else. Because I do think that not all practitioners can do all things. And it's really important to recognize your limitations and your strengths. I would prefer to think of it as a strength. I know what I'm good at. And I know other people are better at other things. And so I just think it's a natural progression. Why would I not want to see them get better and go to somebody who will help them do that?
Yeah, because that's the whole point, isn't it, of them consulting you in the first place, their desire to be better. So do you have a typical client that comes to you now, or do you get a wide variety?
It's quite a wide variety. I mean, I still see a lot of athletes. I'm not particularly affiliated with a team, but I do see elite level athletes still. Executives. It really is anybody and everybody. I try to offer something to everybody because I think that it's very rewarding for me to work with anybody, no matter who they are. And rewarding to see the change that can come from it. But typically people who've tried everything and aren't seeing a benefit, or just feel that there's something within them telling them that they could be better and haven't found the right method yet.
Fascinating. Because there's quite a lot of people that will go through quite a lot of things, aren't there? And for most of us in the UK, the NHS is often the first port of call, isn't it?
It is. And I think... as I said earlier, it is a great service. There are great people in it. The time constraints have really made things quite difficult. And in terms of, say, physical therapies, so one would go to a physiotherapist primarily if they're recommended by the doctor. And so, they don't even put their hands on people anymore. And all those manual therapies that they learned to do, and the manual testing and orthopedic testing, none of it's being done anymore. So it's all just checklists. And so it's time constraints. And it must be equally frustrating for them being in that predicament where they trained to do those things and trained to help people and now don't even put their hands on them.
Yeah, which I guess is another thing that diminished quite rapidly and overnight with COVID as well. And
I don't, some people just chose to stay down that road and, to doing telephone consultations rather than face-to-face. And it's, there's so much you gather from non-verbal communication. When somebody walks through a room, I'm always observing how somebody walks in, and are there patterns that I see there that maybe change as we're talking, and what does that look like to me? What does that mean? And actually it's the most valuable information. For sure.
So is there a typical time scale that people would work with you? I guess it varies a lot.
I think my husband would say I'm too good at what I do. I usually work with people between 2 and 4 sessions for any physical injuries. Longer term, if it's a multifaceted problem where it might be nervous system re-education, that side of things, anxiety and stress, it takes a little bit longer. Most people maximum 6 or 8 weeks, but can be quite spread out over that time. I would normally see somebody the first session and then I talk to them. I never reschedule somebody from my first assessment. I like to see how the body reacts to what we've given it and how the homework's going and how everything's happening. And then we talk about a week later and say, is it now we need to see you, or can we leave it another week? Are you making progress?
Yeah.
Because I do think people do want to learn how to look after themselves better. And it's not something that was really widely available. And that's the direction people are going now. Let's give you the tools and you the intentions and you the rituals that allow you to be the maximum person you can be and be pain-free and fear-free and live your life and be happy.
Yeah, which is that's, to me, what we're all here for, is to be our best, joyous individual selves, so that on a very selfish way, we get the most out of being alive and living in the world, but in a completely selfless fashion, we're giving the best of ourselves to everybody.
Yeah, and I think, we don't always realize how much our energies of who we are impact on other people, and how it can change absolutely everything. It can change a conversation, and particularly when you get into relationships and family and things like that, there's a lot of misunderstanding, and there's a lot of people coming at it from two different directions, and sometimes just even reframing a situation that we've put ourselves in our heads and said, this person doesn't speak to me because they don't like me, and this happened and that happened, and reframing it from the standpoint of, if you and your friends, people close to you that you trust, were in this environment when this happened, what would all of them say? What approach, what would they have seen that you didn't see about the situation? And sometimes you come out with things yourself and you think, hey, actually, it could be that. Maybe they were just really stressed out about something else and really in the zone about that. And they just didn't even see me. It's not that they didn't like me. It's, we kind of make a lot of stuff up.
We're very good at lying to ourselves, aren't we?
Yeah. And I think, we do ourselves such a huge disservice by not being more curious and not exploring it more and actually being open to thinking, could it be something else?
Yeah. And that, I think, is what, for me personally, is so engaging about what you're doing, is that it's the combination of, yes, the body physically needs this movement, this realignment, this correction, but it's not just about whatever has caused that in the terms of the physical sense. It's the combination. Because our nervous system's there to protect us, isn't it, from ancient history. That's its job, to look after us and keep us alive for as long as possible. But so little of that is relevant today, isn't it?
And it shuts down, at certain levels, and you can notice correlations between the event that happened, the age the person was at, and looking at it more from a trauma perspective and understanding how that particular area of the body may have been affected by it, and how now looking at it in a wider circle, zooming in and zooming out, you kind of go, oh my God, all of these injuries are really revolving around that space. And so there has to be a link.
Yeah.
And when you look at, when anxiety is a problem for people and they have a whole left-sided issue, everything happens on the left side of their body. Well, that's anxiety doing that. You're holding a lot more tension over there. If something were to happen that jars you and you're holding yourself already with tension, it doesn't take a lot more to over-contract a muscle and create joint problems and create strain and create all of these things. And so many people think of muscular and ligament problems as being a tear, and it isn't always a tear or a rupture of something. It can actually just be a quick contraction that over-contracts and creates exactly the same symptoms. And so when we're talking about how things feel in our bodies, and I always think about anxiety, and I say to people in workshops that I do about them, is that there's a very fine line between what happens in your body when you feel anxious and what happens in your body when you feel excited and joyful about something. Physiologically, your body says the same thing, but your mind tells you the difference. Your mind makes up the decision of whether you're going to be excited about something or whether you're going to feel anxious.
Wow. That's interesting. I've never thought about it like that before. And I guess that decision that your mind makes is based on what's happened to you in the past. she says, guessing.
Yeah, some of it's past experience, some of it is how we feel about ourselves. And so again, just coming back to that whole journey of the self, it's about finding who we are and having compassion and love and belief in ourselves. And we can't do that until we can identify with who we are and what our values are and what means something to us and what can we leave behind because we're not bothered about it, and it just, all of that's important. And we forget that because we're so caught up in life being this whole big external thing. And social media, I think, does a lot of that. Everybody's paying attention to what everyone else is doing. And it's like, but what are you doing in your own body? What are you doing in your own mind? And who are you? And it's so easy to get caught up in all that.
Isn't it? And I mean, that expression, comparison is the thief of joy. I think that's a wonderful expression because it's so relevant to today with social media, for instance, isn't it? That's just blasting. And I fear for our younger ones that have never known anything other.
Yeah. And I think it is different. I mean, I feel like for the age and stage I'm at, I've probably we've seen the most amount of technology change and geopolitical change, all kinds of things going on in the world. And it's now sort of feeling like everything's becoming more detrimental. So I do think younger generations are going to absorb that. And it's, mental health is becoming a really big issue in 18 to 21-year-olds and probably even younger,
Hugely.
We need to sit up and take notice and get people's nervous systems into a better state and have a better sense of self and identity and be confident in that. Yeah. Be who you are and be happy with that because you only get one go.
Absolutely, but the system doesn't encourage that, does it? It encourages all to behave in a certain way and fit into certain boxes, achieve certain things and become en masse. It doesn't tend to, for the vast majority of people, covet and encourage individuality.
And I think that's where labels really, I've lost it for me. And it started with injury-based things, to call something plantar fasciitis or to sciatica. Yes, those are things, but it's a bucket term for anything that has pain in those areas. And so it doesn't mean to say that all of those things are treated in the same way. And so as you're sort of unraveling who somebody is and how they're put together and the decisions they make and how they move and everything else about them, you could never give them the same things you give to somebody else. And so that kind of is the crux of how I work. But it's kind of expanded. And I think, just me in a general, I just feel that there really shouldn't be labels. It's not helpful. And, I've had this conversation with people from an attention deficit side of things, and people do talk about it and autism, that we do need to have labels to get help. And I guess that's the only way I could see it being useful. But
yeah,
I just think labels overall, it categorizes somebody and it limits who they are and it doesn't allow any natural thought for the individual.
Yeah, I agree with that. And I feel similarly. I mean, like you said, bringing up, attention deficit and autism as particular examples. I know a lot of people feel, especially if they get a diagnosis in later age, that they kind of have a bit of a aha moment and go, so that's why. And I think in that sense, it's a good thing.
I think as long as we don't get too hung up on it, and I always say to people, that's fine that you're carrying this diagnosis with you. And, people often come to me and they'll have a handbag full of x-rays from 30 years ago. And I said, if you took your mobile phone and you took a picture of yourself now, and then 3 months from now you took another photo, would you look the same? No. And I said, so what happened in those x-rays and those scans 30 years ago is not who you are now. You're not broken. Don't hang yourself on that diagnosis because it isn't who you are. And things do change and our bodies are adaptable. And, the body's an incredible thing. And we just really don't pay enough heed to it, and so many things do have the capacity to heal. They just aren't given the right environment at the moment.
Yeah, I would completely agree with that. Totally. And whether that be because the system can't deal with it. And it just goes right back to the very core, isn't it? We mentioned this right at the beginning where we were talking about there needs to be a level of complementary services alongside that are working together, where GPs or any hospital-based doctor doesn't feel that they're having to kind of go, well, you could go and see so-and-so.
Yeah.
Do you know what I mean? It shouldn't be like that. We should all be able to embrace each other. And whether there's a fear in medicine that we're going to somehow take away something from them, that if that is the mindset, that needs to change.
I think, I think it's a science thing, really. It's about having the information and the data to drive that's provable somehow, and that there is enough there. But that kind of frustrates me to no end, because I often have this debate, and it's about a male-female side of things, and women are, I feel, not as well catered for in the medical industry because the research is driven around men, because men were primarily used to do the research on, and therefore the results reflect male anatomy, male physiology, and so we aren't the same, and and that creates a problem. And even from a fitness point of view, you sort of look at the 8 glasses of water that we're all meant to drink a day. I don't think I've ever done that because it doesn't suit me. I do drink a lot, but not that much, I don't think. And all of that data was based on a 1950s male. Even job, what people do for a living, the levels of stress around them, everything has changed. We can't base any health data on something from the 1950s because life was different then.
Exactly. I mean, that is literally a whole average lifetime, isn't it? 75 years ago.
And, everything's changed. Our life expectancy's changed. The way we move around in the world's changed. Everything's changed. And yet we're using all this old data. And I don't get it.
Do you know what just popped into my head then? Oh, my goodness me. It was something that did show up on social media, but it just made me laugh. There was a picture of James Dean, black and white photo, looking super cool, lounging over his motorbike, fag hanging out of his mouth. And then a comparison to now, where somebody's on one of these electric scooters scooting around. And I forget what the whole point of it was. It was basically, it's what have we become?
Yeah.
But it epitomised to me then just what you were saying about how we move around differently.
Yeah, and everything,
everything's different.
Everything's different, and we have to adapt what we use alongside it and be more flexible about it. And there was I was talking to somebody about this yesterday, actually. There was a show on the BBC, and it must be going back about 10 years now, where they took 3 complementary medicines, and one of them was, there was acupuncture, reflexology, and I'm struggling to think of what the third one was. But in the reflexology side of things, there was a woman who specialized in reproductive and fertility, and they'd had a huge party where there were 50-odd couples who hosted this event in honor of her, who had children because they saw her.
Wow.
Yet from a science perspective, they were going, no, there's no connection between the nerve endings in your feet and anywhere else in your body, and it's just complete rubbish. It doesn't work.
And yet you've got the evidence there in front of your eyes.
And so the proof's there, and I just sort of think there needs to be a little bit more joining up of the two, because they can really help one another.
Yeah. Well, I'm hoping that by talking to people such as yourselves who strongly believe in that, as I do, that we can start to open people's eyes. And it just takes a little bit from lots of different sources to help people just start to wake up a bit, I think.
And I think, it's just having that openness and that curiosity sometimes. I mean, I often say to people who ask me, oh, well, would acupuncture work for me? And I said, well, what do you think about being stuck with needles? And they're like, well, I'm not so keen on it. And I said, well, you've got to think about what you feel comfortable with and how happy you would be with that, and whether you believe in that and that's going to help you, because belief is a huge part of it.
Isn't it?
And it's belief in the individual, and belief in the tools they use, and belief in yourself for getting there. And if any one of those are lacking, it will slow you down.
Yeah. Yes. Which can't be addressed with traditional medicine.
No.
The time's not there. You haven't got the opportunity to form a synergy with the person, an energetic exchange, which I think is so important.
I think sometimes it's our feeling of where we fit into the structure and hierarchy of medicine. It's sort of they're on the pedestal and they're the expert, and I think it needs to move away from that in some ways, because it's every person I work with teaches me something new. Every person. And it's a collaborative thing. Yeah. And there are things that I look back and self-reflect on a session with somebody and think, well, I could have done that differently. And it changes me going forward. And so my work's just constantly changing. I'm always changing my assessment forms because I always think, oh, well, I haven't got that on there now. I need to add that in.
Yeah.
It's a process. I'm not trying to use something from 50 years ago or...
Precisely. Yes. Yeah. Things move on.
Yeah.
Things move on. So do you see your practice changing in any big ways or just subtle refinements going forward?
I think I'm kind of where I feel happiest at the moment. There was a time where I was always reaching for new things and thinking, I need to do this. It would just, people would appreciate this. And the people I work with would need it. And you can only have so many skills and you can only concentrate on so many things. And every once in a while I do this mad flurry of training and then I kind of sit back and go, well, actually, I need time to implement this, because if I don't, I lose those skills and the whole thing was pointless anyway.
Yes.
And maybe there are only parts of it that you pick up along the way because those parts are particularly relevant, but it's just about sort of finding your lane. And for me, I think it really resonated with the whole stress side of things and anxiety, because I'd personally been through it.
Yeah.
And because I'd had such good success on the physical side of things, helping people with chronic injuries and understanding how the body moves and how we can repattern things to actually be better and more efficient and find more ease in our bodies, and things like arthritis, and so many people think arthritis is a negative thing in your body, and it's actually a positive thing. And when your body has space that should be even around, say, a ball and socket joint, if the joint moves forward, the ball joint moves forward and it creates less space at the front, your bones will wear down to make room for it. And it will create more bone at the back where there is space. And so your body's trying to help itself. And if you find that alignment, again, the bone will remodel, it will wear back into a space that it should be. And so I kind of question all these hip replacements and knee replacements. I must have had about a dozen people over COVID who avoided surgery altogether because the problem just wasn't in the hip or the knee.
Yeah.
And it's an interesting thing, you're just starting to sort of play around with, do we really need to be that invasive in our bodies?
Yeah. Interesting. Because obviously in my NHS role, I see an awful lot of that.
Yeah. Yeah.
And it does make me wonder sometimes, there are certain instances where something invasive is absolutely necessary. If something has physically torn, one of my catchphrases, my appendix bursting. Yes, that needs sorting out.
Yeah, absolutely. And I do think, but I think there's a problem in mindset with people in general. They expect that they should go through to somebody who will fix them. Yeah. And I think we're getting better at that. I think more and more people are realizing there are so many ways we can influence ourselves to be better without having to go down that road.
Yeah.
And I think so many people convince themselves that once you've got a back problem, you're always going to have a back problem and the only way out of it is surgery. And fortunately, I think there are a lot of surgeons who are walking away from that as well and sort of saying, I'd prefer you to go and do this course of exercise first. Yeah. If you're still struggling, come back to me then, and only doing it if they feel, there's intervention needed.
Yeah. Yeah. I know when I injured myself quite a few years ago now, and I had some imaging and I got referred on to the physiotherapist, and they said to me, Debs, you're like a breath of fresh air. I said, why? I said, because you're looking for us to be the end point. You're not looking at us as a gateway to surgery. I said, absolutely am not.
No.
I that is not what I want. I know my body can help itself. It just needs some guidance as to the right things to do.
Yeah, and as you say, I mean, when there are traumatic things that happen, yes, we do need that intervention. It needs to happen sooner rather than later. But when something's a gradual process, there are ways that we can influence it to improve without going down that road. And I think more and more people are starting to get it. So it's great.
Yeah. Let's keep shouting about it.
Yeah, definitely.
Shout from the rooftops. So have I missed anything out on your wonderful story?
God, no, I now feel like I had to write a book.
Yay! Go for it. Go for it. I'm sure we've all got a book inside us, haven't we?
I'm sure we have, yeah.
Yeah. So I think that to finish up this marvellous conversation, I just need to say a huge thank you to you for travelling down today and for being open and discussing your wonderful journey and your ambitions and how you got there. Thank you.
Well, I hope, that ultimately somebody will take some hope away from it and understand that, if not with me, with somebody, that, there are ways out there and there are people who can help. And sometimes we're sitting in front of the wrong person.
Yeah.
And it's not us that can't heal. It's the fact that the person in front of us has limitations and restrictions that don't enable them to take us any further. And so we just need to stay curious.
Perfect. I love that. Let's stay curious. Thank you, Nicole. My darling.
Thank you. Thank you, Debs.